Hello everybody, and welcome to the Thursday edition of Video Clips. I want to talk about Dr. James Sarno today, the author of this book. I'll tell you about the book in just a second, but Dr. James Sarno was named America's Best Doctor by Forbes magazine in 2012. Sarno, a professor at New York University's School of Medicine, developed an unusual form of therapy for patients who were in pain called knowledge therapy. His educational sessions focused on helping people to understand that in many cases their pain was not due to physical abnormalities, but rather due to mental and emotional causes. Many famous people, including Howard Stern and Senator Tom Harkin, endorsed his methods, and according to a documentary which you can see on Amazon called All the Rage, Sarno influenced the lives of millions of people. He died in 2017 at the age of 94. According to Sarno, sometimes difficult and unresolved feelings can cause chronic tension, which results in chronic pain. He actually referred to the process as tension myoneural syndrome, or TMS. For people suffering with TMS, pain serves to protect them, providing a distraction from feelings that they're not ready to address. I was first introduced to Sarno's work when I found his book, this one right here, called Healing Back Pain, in a used bookstore many years ago. I was fascinated, and I think one of the reasons why the book resonated with me is because so many of our members reported chronic pain and discomfort that just didn't respond to treatment. Many could not remember an event that triggered the pain, such as a fall or accident. The pain just spontaneously began and it didn't get better. During the last 20 years, I've met former patients of Sarno who were cured in a short time after gathering an understanding of the real source of their pain. I've created 2 instructional videos based on this book, which is posted on one of our member sites. But and many of I think I've probably met a couple dozen of his patients, and many of those said, Dr. Sarno saved my life. I mean, I was heading toward disastrous surgeries and that sort of thing, and he kept me from doing it. Steve Ozanich was a patient of Sarno, not one that I happen to have met, by the way, who claims that Sarno saved his life. His back pain started at the age of 14, and for 30 years he tried everything to make it go away. The usual things: physical therapy, chiropractic, and stretching. Desperate, he scheduled surgery that would involve spinal fusion and titanium plates. Just 2 weeks before the procedure, he met Sarno, and due to Sarno's knowledge therapy, has been pain-free ever since. He's the author of 2 books, The Great Pain Deception and Back Pain, Myths, Lies, and Confusion. Ozanich is not a doctor, but Sarno's technique doesn't really require medical training. It simply involves helping people to acknowledge that the source of pain may not be rooted in the physical, and resolving it might involve looking at things like what's going on in your life and changing your mind about some things. In a recent interview, Ozanich reports that often the first response from patients given this information is anger. And he acknowledges that he felt this way himself. He says he initially threw Sarno's book against the wall. Part of the problem is patients often have images showing abnormalities such as bulging discs and bone spurs, and they've been convinced by their doctors that these abnormalities are the actual cause of pain. So they get kind of offended when somebody suggests that the pain is in their heads. And by the way, it's not that the pain is in the head. I mean, if you have back pain, the pain is in the back, but that just may not be where it's originating. We now know that structural abnormalities are not the cause of pain in most cases. I mean, there are just dozens and dozens of studies that show things like people who say they're in pain often have no abnormalities, while people who have no pain sometimes do. A study of 991 people, some with and without knee pain, showed that meniscal tears were just as common in people who have no knee pain as they were in people who had pain. Another study showed that only 20 to 25% of people who have back pain have a herniated disc, while 60% of adults with no back pain have degenerative changes in their spine. So there is a disconnect, it seems, from physical abnormalities and pain. The failure rate for orthopedic surgeries is high, and often people continue to have pain afterwards, or it might just move to another part of the body. Ozanich says that the reason that removing symptoms with surgery doesn't work is it just causes the brain to shift to another symptom as an outlet for the unresolved emotions. Thus, the back pain goes away, but you end up with pain in a different part of the body, and the whole problem starts all over again. Interestingly enough, a spinal surgeon by the name of Dr. David Hanscom takes the connection between emotions and pain even a step further and says that anxiety and anger are the root of almost all chronic pain cases. And this is a guy who makes his living doing surgery who's telling people this. He says that anger and anxiety cause the release of adrenaline, which makes nerves more sensitive, and that when the emotions change, the body chemistry changes, and then the pain is reduced or goes away. And he says this is a whole lot different than teaching people how to manage pain. How about if we try to make as much of it, or maybe even all of it, go away? Now, many people, and even many consumers and even some health professionals find it really difficult to believe that musculoskeletal pain can be caused by emotions and stress. But I think we have to look at the fact that many current approaches to pain are just not working, and some new ideas are needed. I mean, surgeries usually make little difference, and my gosh, we should have learned a lesson from the opiate epidemic that just giving people drugs is at best a temporary fix and might be a ticket to addiction. According to the Centers for Disease Control, in 2016, 20.4% of Americans were suffering from chronic pain, and 8% had high-impact chronic pain, and that translates to over 50 million people whose quality of life is really diminished and who are costing the healthcare system an enormous amount of money. So I think that pain patients should be fully informed about knowledge therapy prior to receiving drugs or undergoing surgery. They can throw the book against the wall, they can refuse to participate, but maybe in the back of the mind you might plant some seeds that if other things don't work out so well, that they would seek a real solution to their problem. Knowledge therapy, helping people understand emotions and stress as the source of pain. It's not very expensive, and there are a whole lot less side effects from it, and you get much better outcomes. Again, I've been struck by the people I've met over the years who really just can't stop talking about how much Dr. Sarno did for them and how fortunate they felt to have come across him rather than pursuing some of the other options that had been presented to them to deal with their pain. So that's all for today. It's all for the week, as usual. Just pass this on to anybody who you think might enjoy watching it, and I will be back to you next week with more news.